The county and our beautiful state of Wisconsin have been plunged into uncertainty and chaos due in no small part to the recent National Reconciliation Bill and our newly passed state budget. Many of us feel destabilized and unsure what resources are available for basic health care, let alone more complex, unique, or life-threatening medical situations. Today's Vel Phillips Forum, Wisconsin Healthcare in Turmoil, is an important conversation today in light of all of the recent events and finger-pointing Milwaukee is currently undergoing. We're very excited to be joined by experts in this area today to find out what these complicated budgets mean to us and to our families. Our panel includes Steven Webb from Planned Parenthood Wisconsin, Crystal Keller from My Way Out, and healthcare writer and speaker Timothy Faust from State Representative Fran Hong's office. Today's nonpartisan virtual forum is being sponsored in part by the Public Welfare Foundation, Wisconsin Voices, the Kohler Foundation, the Hirschfeld Foundation, and Porchlight Books. So let's dig in. I'll start with sharing some broad context around this incredibly complicated topic, and then our panelists will help shed some light on the problems and path forward from their perspectives. This summer, we learned that significant changes are coming to Medicaid, and I'll define a lot of these as we go through. Medicaid is the joint federal and state program that helps cover medical costs for people with limited income and resources. And Medicare, the federal health insurance program for people 65 and older and people with certain disabilities or conditions, and those using the federal marketplace for health insurance under the Affordable Care Act and other healthcare systems. These changes are set to have devastating consequences. Almost 300,000 Wisconsinites will lose health insurance, essential reproductive health care, and cancer screenings will no longer be funded by Medicaid. Many immigrants will lose eligibility to enroll in Medicare. Work requirements and red tape will increase for those on Medicaid, and marketplace premiums may increase by 75%. On July 4th of this year, the federal government signed the 2025 Reconciliation Law into effect. A highly contentious bill, this monstrosity jammed all sorts of nasty items into one omnibus that has dramatically shifted systems that families have relied upon for years. And we could talk about this for days, but today we'll be focusing just on the healthcare components. And right off the bat, we know this will increase red tape for food share and Medicaid members, and as I said before, force almost 300,000 Wisconsinites to lose health insurance. This is atrocious. After much wrangling, the final bill includes provisions entitled Federal Payments to Prohibited Entities that prohibits all direct Medicaid spending to providers primarily engaged, and this is in quotes, primarily engaged in family planning services, reproductive health, and related medical care, if they also provide abortion. Importantly, the Medicaid spending prohibition applies to any of the services they provide, not just abortion services. This means STI testing, birth control, cancer screenings, and many other essential services that these folks have grown to rely upon. We know this certainly means Planned Parenthood, but this also means many smaller nonprofits that provide similar services. Unfortunately, under the new law, Medicare enrollment eligibility narrows to only the following four categories: U.S. citizens, lawful permanent residents, which means green card holders, Cuban or Haitian entrants who qualify under the Refugee Education Assistance Act of 1980, and COFA migrants, who are citizens of Micronesia, the Marshall Islands, and Palau, who are permitted to live, work, and study in the United States without a green card or visa because of the Compacts of Free Association, and that's what COFA stands for. This change specifically excludes any immigrants who are in the country as a result of temporary protected status, seeking asylum, or as a result of other refugee status. For anyone who falls into these categories and is currently receiving Medicare coverage, their coverage will be terminated by January 4th, 2027. That gives them only 18 months of coverage from when the bill was signed. Additionally, the law excludes many people from accessing Medicaid because it increases the cost sharing and premium payments by putting a decade-long moratorium on something known as the Medicare Savings Program Eligibility Determination and Enrollment. They all have capital letters in front of each of those words. That's its real name. According to Reed Smith's Heavy Industry Washington Watch, the new bill also affects the Pay-As-You-Go Provisions Act of 2010. Because this bill increases the deficit by trillions of dollars, okay? The reconciliation law that was passed increases the deficit of the United States by trillions of dollars. This triggers a payment reduction for already underpaid and overworked healthcare providers. So what was created, because it forces the deficit to be so much greater, now triggers an additional problem. The bill also added an 80-hour-a-month work requirement or a half-time school enrollment requirement for people seeking enrollment in Medicaid. This affects what they call able-bodied adults ages 19 to 64 who don't have children under the age of 14. Now they'll need to demonstrate that they are working or otherwise training or attending school for at least 80 hours monthly. They'll also have to enroll in this new program and reapply every 6 months, proving that they are meeting these new criteria. This has been tried in different states before, and it was shown to cost a lot of money to administer and verify all of this, let alone the burden of complying with all the reporting requirements. On the upside, parents with children ages 13 and under who are medically frail and those who are participating in a substance use disorder treatment program are exempt from the requirements. It does, however, specify that if a person is denied or disenrolled due to work requirements, they are also ineligible for subsidized marketplace coverage. The Congressional Budget Office estimates that this will save, and I'm putting that in quotes because they're putting an unfair price tag on this, save $360 billion due to these eligibility restrictions. So because people are getting bumped off coverage and don't have access to these resources, the CBO views this as a savings. And finally, at least concerning federal changes in my preamble, there are changes in the Affordable Care Act. Most people getting insurance through the ACA marketplace use automatic re-enrollment. This will no longer exist, and they will have to go through the enrollment process each year now. And since there are not more enhanced tax credits, actuaries predict that the premiums will also increase about 75%. Now, the recent Wisconsin state budget for 2025 to 2027 has tried to shore up some of the negative effects anticipated to hit us, as well as addressing some of the chronic issues we've already been facing. I know this is complicated. I'm reading all of this, and I want to tell you that this took me hours of research just to write those few paragraphs, and 3 of my colleagues had to help me break it down into English so that we felt I could understand what the hell it was I was saying, and hopefully you all could understand what we're saying, because it is so complicated and there is so much information. And the terrible thing about this is this literally affects almost all of our families and friends, and certainly affects somebody that we each know. And that's what's so atrocious. Even those of us who are educated and work in adjacent fields who study this have to do intense research just to get a handle on what we're talking about this evening. As a result of the state budget, some seniors will receive some retirement income tax relief. This includes $24,000 for single income or $48,000 for married couples. It will increase income tax cuts. And there are some new health care and aging services allocations for aging and disability resource centers statewide. It's maintained funding for Badger Care, and a $7 million investment was made in the 988 Suicide and Crisis Lifeline. And there are many other supports for bridge payments and other offsets to providers and funds to offset copay for low-income families. Helpful as this appears, it's the state's equivalent of digging little trenches to protect your sand castle from the incoming federal tide. And as we set these horrible new circumstances against the backdrop of the poor health care we already had in our state, the most fragile of us, those who are dependent on care, those who have no choices for care, such as the elderly or incarcerated, we're already wrestling with egregious realities. Perinatal care in the criminal legal system is notorious for being poorly implemented. Notorious, especially as compared to their already notoriously bad health care and medical care for other individuals that are in the charge of the state as incarcerated people. And this is an issue that has sadly remained consistent since I arrived here to Wisconsin in 2006. It has been in previous budgets, it's been wrangled with in the DOC and the state capitol, and just this year was the subject of a successful lawsuit by the ACLU and Quarles and Brady. So what does that mean for us? And more importantly, what can we do about it? As we go forward, we're now going to take a moment. We're going to introduce our wonderful panelists, all of whom are experts in their field. We're going to let them introduce themselves. We'll start closest to me with Steven, and I'm going to ask each of you to briefly tell us your name and how you are involved in advocacy or work in healthcare.
All right. Well, first of all, thank you all for having me. I'm really, really glad to be here. My name is Steven Webb II. I am the Executive Director of Planned Parenthood Advocates of Wisconsin. What I do is I go around and I make sure that everybody knows that Planned Parenthood doors are open and that we're there for them and that we have a place for them to get involved and to get educated and to be able to be in a space to be heard and use their power to make sure that their voice is being heard when it comes to the issues that matter the most to them and their community.
Thank you.
Hi, I'm Crystal Keller. I'm a reentry support partner with My Way Out. We're a nonprofit reentry organization. We help individuals all across Wisconsin that are justice impacted, whether they have an open criminal case pending, they're incarcerated, preparing for release into communities throughout the state, or if they're already released, whether they're on supervision under DOC or they have a conviction record from years ago and they're still trying to obtain stability in their lives, we're there to support them. Everyone at My Way Out is also justice impacted, so I've been incarcerated before too. We all happen to have felonies, so we understand that. We're credible messengers who've walked that path as well. And something that I really am passionate about is helping individuals with health care. A lot of what we do is referring people to different community resources that are available throughout the state. Prior to working at My Way Out, I did work in state government at Equal Rights, at Department of Workforce Development, Department of Health Services. During the pandemic, I was a food share Badger Care worker. It was nice then because if someone already qualified for Badger Care and then they called in to report their job, we couldn't cancel them. There was a moratorium during the pandemic, which was a great savings to people. Unfortunately, there is a lack of affordable health care already, and then when people are releasing from incarceration, it's just how do they get back on their feet. We have a lot of people too that may have had substance use disorders and things that they're overcoming, and hopefully they got treatment while they were locked up, but then we need to connect them to something so they have support when they get home. They're at very high risk of relapsing. And I mean, getting a job with a felony record, especially if you don't know your rights, good luck. It's really hard. But also then, if there's a work requirement, how are they even going to meet that, to be able to have health care? So I'm concerned about these changes. It's tough enough without adding extra restrictions for our people.
Thank you.
First off, Emilio, I want to say congrats on getting that all together in that speech in 5 minutes. That was robust and everything was accurate, and I really appreciate that. That was really, really well researched. I'm being very genuine.
Thank you.
Thank you guys all for being here. Everything we're talking about was very sad, but I like having these conversations with people. Literally every single person sorry, this mic is being a little fuzzy. Everybody I've ever talked to in my entire life has been somehow affected by the healthcare system. It is the, in my opinion, universal issue. And so I'm very glad we get to talk about it together right now. And that includes you guys on the internet. My name is Timothy Faust. I've been bopping around healthcare activism and policy for a while now. Helped enroll folks in the ACA in the Southeast in 2013. Spent the years 2016 through 2020 driving around the US, including coming to Milwaukee several times to talk about things like Medicare for all and try to demystify the way that our healthcare system works. I used to be an abortion worker in a state serving people in banned states, and presently I am here. I'm not here in a capacity of, but I currently work as an intern with the Wisconsin Legislative Socialist Caucus as the health policy advisor in Representative Francesca Hung's office, on behalf of whom I am not speaking today. This is just me freestyling. And that's my story.
Thank you. Sometimes it's important to contextualize what we're talking about because it seems so complicated, it seems almost ethereal, and we just have this existential dread. I'm hoping that you can each maybe share an example of how our healthcare system has impacted you or somebody you know so that we can better understand the human cost of these issues, so that we can personalize it.
Yeah, so I'll go first. At Planned Parenthood, sometimes we have folks, patients that come in, and they have been dismissed by other providers. And one of the things at Planned Parenthood, we believe in healthcare with dignity and patient-centered. And so that really allows us to help that woman find out the early detection of her cervical cancer, right? And so that is very meaningful that we were able to fill in the gaps to be able to listen to her, give her the services that she needs for her to be able to move forward, and for Planned Parenthood to be able to fill in those gaps for the patients, and not only for the patients but also for the provider. And that's one of the things that happens. It's always really, really good to be able to be in this space, to be able to support people like that, because everybody hates cancer. That's one thing that we have in common. So for us to be able to be there, it's very, very impactful.
Thank you.
Well, I've spoken to Emilio about this as well. I do have one of my children who's currently incarcerated. She was incarcerated previously as well in the state of California for 3.5 years at the age of 19, released at 22. And when she was released disabled, totally disabled. She was catatonic, dystonic, and had drug-induced Parkinsonism because of the medication that she was being forced injected by the California Department of Corrections. She could not walk. She could not speak. She understood what was going on around her, and to communicate, I had to ask yes/no questions and have her squeeze my hand once for yes and twice for no. It was devastating. She was locked in a cell and then locked in her body when she got out. And they said it might take 18 months or so to be fully rehabilitated. Similar to Wisconsin, when people are incarcerated, there's usually social workers that work with them, and they try to get them connected to whatever that state's Medicaid program is. In California, it's Medi-Cal. Here it's Badger Care. And they enrolled her in the wrong county and had her parole set up in the wrong county that she did not live in. And I even moved back to Wisconsin and saved our apartment in Sacramento County, not the nearby one, so she'd have somewhere to go when she got out. And because she was released disabled, drooling, couldn't move her arms, couldn't blink her eyes, all the specialists that we needed, the neurologists, the physical therapists that had to come home, none of that was available. And I worked for the state here, and they were making me come back. I'd have to find someone to watch her so I could fly back last minute and point down the hallway at the building that we used to be at on 12th and Valete. And they wouldn't approve me to work remotely, even though my job was remote from there, to take care of my suddenly totally disabled child. So, I've seen the devastation. That's why I work in reentry now, too. It's not just that I've been incarcerated. I mean, it's experiences like that where I want to make sure people do have support. But, I had to talk to ombudsmans and things, too, to get her switched over faster. I'm like, how can this error even be made? And in her health care, even though she was a dependent of mine through my insurance, through my employer, it didn't count for care outside of the state of Wisconsin because I was a state employee and we were in California. I eventually had to get her parole switched out here, and that was a hassle too. So, when it comes to incarcerated people, we really need to do better for them. Otherwise, they're being set up for failure in healthcare and many other ways. I am glad, I know the work I do is statewide, so I do reach out to a lot of the county health and human service departments. I work a lot with the DOC social workers and treatment specialists too, to make sure that they have resources for their people. But here in Milwaukee County, we have the Access clinics, which has been great because they accept walk-ins. They can provide medication too and care up to 6 months. If they need something longer term, they'll help them look for a long-term provider. But that can really help with that bridge of, coming home from incarceration and getting access to any kind of behavioral health care that they may need right away. I wish we had more of that throughout the state. In the rural areas, it's quite hard to find those kinds of services and resources. It's very limited. But yeah, I've never seen anything like that. And my daughter was a fully functional person when she was taken into custody, so they disabled her. There's no doubt about that.
I wanted to talk about humanizing the whole structure of healthcare, and so we can see how people operate within it. The thing about healthcare is that healthcare shapes every part of your life, and every part of the world shapes the healthcare system, right? Whether or not you have clean water to drink affects your healthcare and affects your interactions with the healthcare system. Whether or not your neighborhood is safe, whether or not you have a good paying job, whether or not you have like a community that that helps you or a community that harms you, shapes your ability to receive healthcare and the kind of healthcare you get, right? And the kinds of structures and oppressive forces that already exist in America converge in healthcare, right? Even if you control for income, black men receive worse cardiac care than white men. There's just a lot of structural things inside the system. You know, it's no coincidence that one of the biggest potter's fields, where they bury people who don't have any money in America, is next to a neighborhood that's next to a nuclear waste disposal site. All these things interact. But it's infrastructure in a lot of ways. The way that the healthcare system was arranged doesn't control, but props up so many parts of our life that we can't see. Medicaid, the program that was just cut, I think is the piece of social infrastructure in the US. I've got two quick Medicaid stories. One of them's positive and one of them's not. The positive one is about me. I'm a person for whom Medicaid worked. Back in 2009, I got swine flu, which was the trend at the time, and I was laid up. Couldn't go to work. I was making, $12,800 a year, working 3 jobs on my ass in my really tiny bedroom, unable to go to any of my jobs, and I ended up going into massive credit card debt. I mean, like $3,000, which again was a quarter of my entire annual income. Swine flu you can't treat, but I still went to the hospital, and all I really got for it was a big bill. Put me even further in debt. And so I learned a really important lesson, which is that if you're poor, never go to the doctor, which is a lesson that I held on to for years. Until 2012, 2013, I began getting a sore throat and a weird cough, which, I ignored. That's my job, always just keep on trucking. And it got worse, and it got worse, and it got worse, until one day my roommate Erica wakes me up, and I am unable to make sense. I am totally delirious. She rushes me to the hospital. I've got a fever of 103.7, which, if you're not a doctor, is way higher than temperatures are supposed to get normally. So they bring me into the ER, they pump me full of fluids and goos, and they wheel me out, and the next day I go to the receptionist's office and I get a bill for $4,000. And I break down crying, because that would have completely ruined my life. The ACA had expanded recently Medicaid eligibility in California. So the receptionist, this angel, looks at me and says, listen, go back and get some forms and come back here tomorrow and we'll see what we can do. So I go and I get my file print Wells Fargo bank account, the only thing I had, and some like 1099s or whatever, and she enrolls me in Medi-Cal, and my $4,000 bill dropped to zero. And it is impossible for me to understand what my life would look like if I was in that much debt at that young of an age, right? I have a life that I like quite a bit. I've got a wife and a dog and a house and all these things and friends that make my life rich. And the only reason I have these things is because Medicaid was there to prop me up when I needed it. So I can have a life where I do things that I care about with people I care about. Medicaid worked for me. I've got another buddy who Medicaid worked for and who also battles against it still. His name is Steve. He lives in East Rutherford, New Jersey, near the MetLife Stadium. Steve has muscular dystrophy. Basically, his body is allergic to itself. When he was born, he was given a life expectancy of 18 years. He's currently 34. Steve's a trooper. But Steve is totally disabled. He uses a wheelchair. He weighs something like 90 pounds sopping wet. And so Steve can't go to the bathroom by himself. Steve can't feed himself. Steve can't clean. Steve needs help operating in the world we live in. And so when Steve was born, Steve's mom left her job. She worked at a bank and she liked her job and it was good, but her son needed help, so she left her job to take care of her son full time. Easy sacrifice, but all of a sudden now they're a one-income family with a lot of medical bills. When Steve was 16, he got qualified through Medicaid for home health care programs, which means that one of Steve's, they hired a guy named Kyle to come to Steve's house and help Steve go to the bathroom, clean himself, move around, which meant a couple of things could happen. One, Steve got to live a life that Steve deserves to have. Steve is a substitute teacher. He's a stand-up comedian. He's an actor. Have you ever seen Rami on Hulu? He's in that. Really talented, really funny guy, and because Medicaid was there to provide home health, he gets to have a rich and full and interesting life. He's a really cool guy who does really cool shit. But on top of that, Steve's mom got to have a life that she wants to have. She got to go back to work and support the family in a way she wasn't able to before. So that's great. Like everybody turned out happy. But we still, in this country, have this belief that some people get too much health care or some people aren't deserving of the care that they need. So every single month, a nurse from Blue Cross Blue Shield who administers Steve's Medicaid program has to come to his house to check to see if he's still disabled. And if he is still disabled, he gets to have home health care again. And if they miss the appointment or there's too much traffic or something happens, all that money goes away for the next month. Total morass. All these little pokey things to find who is the most deserving of health care, who's scamming, who's getting away with it. Steve has to fight. He was flying recently and the wheel on his wheelchair broke. And it took him 6 months to get a repair because Blue Cross Blue Shield, who administers the Medicaid plan, doesn't want to spend money on people if it can avoid it. We have this pathology of fraud, of fraud detection, of crime, of suspicion. And people who fall through the cracks in other circumstances, in Steve's case, a disabled person, fall through the cracks and it's compounded and it shapes their life. So for all the good things Medicaid does, and I think it's an essential program, it's my favorite program in the US, I love it very much. It is still created upon a foundation of, I think, an American illness and American sickness. And so, for everybody who has a good story, there's 5 more that have essential care frustratingly provided.
Thank you, all 3 of you, very powerful examples. It seems hearing these stories, comparing ourselves to other countries, comparing what we've got to what we want, and understanding that despite ideological lines between political parties and elected folks, polls show that there is broad support for taxpayer-subsidized public health care in the United States, along the lines of what we do see in other more developed nations. How can we break through this gridlock and what's happening and maybe build a coalition of voters and communities that can get elected officials from both parties to push this forward? Is there anything you see in regards to shifting this? Because I'm 56. I have heard this and the complaints about our health care as long as I can remember. I still save, and this is a funny little anecdote, my personal relevance to the healthcare system. There was a sheet of paper I found when my mom passed away a few years ago, and it was from the doctor that we had in Queens where I grew up. And it said, birth 1 baby boy, $250. Circumcision, a week later, $20. And then a couple of years later, birth 1 baby girl, $350. No circumcision. And then and a couple other things. It was like a shopping list written in paper that the doctor had written on the list. And my parents still paid for insurance, and I remember growing up and how difficult it was and how that influenced what job they chose based on not that their heart was into that job necessarily, but that they could also provide for one another and provide for their children, because we in the United States don't have what other people in other nations may have. And so fast forward now to 2025, do you see some sort of way that we can move past these ideological lines drawn in the sand to push things forward?
I can bop it on that one. And the answer is, what the answer usually is that you got to talk to your neighbors. You got to talk to everybody you can. See, every single person I've ever spoken with in my entire life, unless I'm forgetting them, knows that they're being screwed over somehow by the healthcare system. I was in Eau Claire over the weekend, and I stopped by a bar because I needed to use the restroom, like a bar on the side of the road in Chippewa Valley. I'm sitting there with my friend, and 2 conservative, rural guys walk up to us and buy us a couple of beers. We buy them a couple of beers. And the only thing we talked about is how much the healthcare system sucks. And I don't think you should, compromise or collaborate. I'm not really a friendly guy, but there are the fundamental truths of how we're being pushed over are so universal and so shareable. We were able to identify things in home health care, taking care of Todd's mom, that was his name, and how the home health dollars keep depleting, talking about how hard it is to buy employer-sponsored insurance if you are an employer. There's so many points of commonality. I have not found a single person I can't talk to about some part of all this bullshit. I was living in Boston in 2017 or 2019, which I cannot recommend. And I was working on a book, and I went to this bar, the Frogmore, fine. And I'm sitting there working on researching my book, and I sit down next to this guy who's wearing a MAGA hat. He was being very edgy. Wow, look at him. We started talking about what was on TV. It was the Houston Rockets, and we get talking about what I do when I'm working on a healthcare book, et cetera. And, he disagrees with me about Medicare for all. He doesn't think we should pay for lazy people, or people that are scamming the American healthcare system. But there had been a heat wave in Boston that summer, and a bunch of low-income senior citizens died, including his aunt. And he asks me, said to me, I just don't understand why they can't provide free air conditioning for poor seniors. That's healthcare. That's a healthcare issue. You can build upon that. And so we had the Medicare for all question in 2019, 2020. If you can recall the before times, it was the central argument in the Democratic primary debate was Medicare for all. Everything came back to it over and over again, or perhaps I have a selective memory. In 2024, it wasn't an issue. I think that was a fluke. I think we'll see it again in 2028. But we can't bank upon a charismatic candidate. We can't bank upon an issue being raised that'll elevate us. It has to happen through mass organization. And the only way we build mass organization is little by little by little, then all of a sudden all of a lot. So there are things you can do. You can join an organization. There are a lot of great ones out there. But the most important thing you can do is find the people in your life who don't come to events like these, who aren't engaged with people like me who like talking about healthcare, who don't consume that content, read that kind of news, and talk to them about what's happening in their life. Something like 70% of people get their information about the world from people, like from their friends, from their family, even more than they get from streamers or news channels. And so we have to be ambassadors to people in our life, even people we don't agree with, about how are you being screwed over by this whole thing? Let's take it apart. Let's analyze it. Let's think about it. People love complaining. Commiseration is the best way to make a friend. And through commiserating about the healthcare system with people all over the place, conservative, rural, Democratic, liberal, whatever, that's the only way you build the momentum so that when something like Medicare for All pops up again with strength, we have the ability to break through the massive and massive and massive amounts of industry money, cognitive bias, racist Fox News bullshit to punch through. So yeah, it's talking to people. It's the slow, tedious work of being friendly.
Would either of you like to add anything to that?
So just to add on to that, most definitely it's all about being a community. But I would say education, right? Most definitely understand what is at stake, figure out how that is like impacting you and your community, and then get involved. And so going out and knocking doors, having conversations, reminding people, of their civic duty. I would say donate. We got to have a little skin in the game to help support candidates and help support these issues. Become a patient. For us at Planned Parenthood, most definitely become a patient so you can come and get your STI test, your birth control, your cancer screenings, and even so your wellness exams. And then I think just the biggest thing, just holding your elected officials accountable for the votes that they vote for. So that's what I would say.
I would say take the profit incentive out of healthcare because it's disgusting to make money off of people that are sick, injured, and dying. And then we can be more proactive with the service we provide. Other countries that do have like a healthcare plan for all for their residents, they have a better healthcare system anyways, and they're more proactive. Here, we're reactive, right? Like you explained in your story, you waited until your neighbor took you into the ER. Maybe whatever was going on could have been caught sooner, and that's the case with a lot of our stories, right? We don't want to get stuck with a bill. We might have to take off of work, and it's a whole hassle. Well, if we could just go to the doctor for a regular checkup every year and not be worried even about that as a charge, fine. And we already are paying. We're paying a lot. If you have health care through your employer, you are paying a premium every month. I don't have a health care option through my employer. We're a small organization. I have to go through the Affordable Health Care Act plan. And when I got a raise, my my tax credit that I decided to use for my premium was no longer there. So my monthly, for the very lowest cost healthcare plan, just for me, a household of one, was over $500 a month. So like hopefully I don't get hit by a car and have to actually use it. And when I did get sick, guess what? I did not go to the doctor. And when I needed to get a shot, because I do work with a high-risk population, you know, I get my flu shots and my COVID boosters and things every year because I don't want to get sick and pass it to anyone. I just went to the healthcare clinics. I didn't go to my doctor. So we're already paying a lot in our healthcare anyways. Just tax everybody and put it into a pool and don't make profit off of it. That's disgusting.
I hope the people out there are taking note. Somebody listens. You know, you also bring up ACA comes up a lot, and probably one of the bigger advancements we've had in the past couple of decades, at least in regards to healthcare, has been the passage of ACA, or Obamacare, as most of us know it. How did this change the healthcare landscape? Can any of you speak to that? And where does that leave us moving forward? Is this something that we can build upon to move forward or to address some of the obstacles that we're clearly seeing today?
So the Affordable Care Act, here's the setting in which it happened, right? I don't know if any of you guys recall the year 2009. 14 or 15% of Americans were uninsured back in 2009. Following the ACA, 2023, 7% of Americans were uninsured, which is still an insanely high number. As far as a blunt question of getting more people covered in insurance, the Affordable Care Act did a pretty good job. The bulk of that was by the expansion of Medicaid. There was also the whole, creation and regulation of the individual insurance market when you go to healthcare.gov and buy a plan and pay fucking $500 for it. That happened too, and that insured millions of people. But the expansion of Medicaid across most states was the main driver of increased insurance. What the Affordable Care Act didn't do, including universal health care, was address cost. Medical costs have sometimes more than doubled, sometimes even tripled in the past 15 years. That's because the Affordable Care Act is predicated upon the idea that we all understand that the healthcare system is very complicated and nobody can afford to pay for healthcare on their own. Nobody can. No single person, if they got hit, no single normal person, if they got hit by a car, could go to a hospital and pay the entire bill out of pocket. Just not possible. And so in order to address this, the Affordable Care Act had the brilliant idea that we should subsidize a lot of these private costs with public money with no constraint. If we just give Blue Cross Blue Shield, if we just give United Healthcare a bunch of public money, maybe they will make insurance affordable enough that people can stay on their plans and not get kicked off when they have a disaster. And to an extent, if you want to arrange your healthcare system that way, that construction functions to an extent, but it's really like a car running with three wheels. The Affordable Care Act was good, but I think an argument can be made that it derailed a lot of actual progress. There was no public option. Their Medicaid expansion, though it was not necessarily the intent of the ACA, was left up to the states with a lot of other choices. I think, we can reflect upon the fact that a lot of things, good positive things happened because of the ACA, but fundamentally I think it did derail a lot of the momentum that was pushing for things like, whatever version of universal health care what was in vogue 15 years ago. A lot of that simmering resentment was temporarily placated, but not redeemed, not absolved, not fixed, which we saw, with the appeal of Bernie Sanders and the Medicare for All movement in 2016 and 2020. The one big beautiful bill is the single largest retrenchment of healthcare benefits ever to happen in the U.S. It is as radical a reform to American healthcare as the Affordable Care Act was. And, we'll see what the consequences are down the road, and they're not going to be good.
Yeah, I guess I'll be vulnerable and just talk about me. So it was back in 2009, and so for me, I was in college back then. And back then we call the inspirational phase, right? I'm looking for a job, right? But you don't have enough work experience, right? And so it was just, went to Alabama State, and it was just 55,000 people on this campus, and nobody, you turn 18, you're off your parents' insurance, 5,000 first-time generation students on this campus, and there is no reproductive health care nowhere to be found. No, none of that. And so what ended up happening for me and a lot of my folks was like, I was like, nope, I'm not playing no intramural football. If I get hurt, I'm just gonna sit at the house and just wing it and hope that I'm young enough that the swelling will go down. But luckily, on in my career at school, the ACA did come and I was allowed to get on my parents' insurance, and it was very, very helpful. I just remember before I wasn't where my wisdom teeth had came in, and I didn't have the money to get those pulled out. I had got an STD. I didn't have, any money to go there, and God forbid I was gonna give my dad a SCI invoice and can you take care of this, But the thing is that, it had real life implications on that campus. And so most definitely, when I was hurt, it was nothing that I could do. But it was also one of those things where a lot of folks came to school, first-time generation for their family, and either got pregnant, and if they had a good enough family, they would send their baby back home to their mom. But if not, they had to drop out of school and work. And back then, working was like a thing where, yeah, it's full-time, but I'll give you 36 hours, so it's not 40, right? And you just keep working. But the good thing is that ACA did come, and I ended up being able to get on my mom's insurance. And so one day I had a wreck and really messed myself up really, really bad. And the bill was over $125,000, right? That's how bad it was. I was in the hospital for 3 months. And so in the midst of me trying to get back to reality, the $126,000 bill is just over my head, and I don't know how I'm gonna pay it or anything like that. I don't even know how I'm gonna get back to myself. But luckily, as imperfect that it is or was, it helped me out. It helped me get through that, and it's one of those things that helped me continue to go and to advocate for these types of things, because it has real world implications and whatnot. And where do we go from now with this? I think the thing is that we continue to push it forward. It's just postpartum, a lot of things that are just in that, we just really, really need, and it has real life implications, right? We all know somebody that has, it hadn't been that long, right? 2009, I still kind of remember how that felt. And so a lot of people remember that. And so it's real life applications. And so that's why, we need to really, really step up and take a look at ourselves and say, it may not be me right now, or it may be somebody else, but we have a human collective, obligation to each other.
As an aside question, one of the things I've noticed recently is I don't think people even know where to go to get information. Both of you, and I share this too, when you're younger and you're sick or something hurts, I'm not going to the doctor. I can't afford that. I don't know how to navigate this. And we get requests. We do a lot of free programs in the community, free yoga, free Zumba, free older adult programs, free veterans programs. And people have a good time, and it's a component of wellness. But many people don't even know where to go to get these types of questions answered. And now with the fear and the burden over everything new that's been unleashed in the reconciliation law, just articulating it is burdensome. Can you suggest places where folks can get an answer? I did see, as an aside, County Supervisor Caroline Gomez-Tom just did an interview on the ACA health plan price hike, and she had some interesting little tidbits. I haven't watched the whole thing yet. I saw a little Facebook snippet, but I'm looking forward to it. She's very knowledgeable, but that just reiterates, when you're looking under the comments on social media, people have no idea where to go to get these questions answered.
Yeah, most definitely. I would say for Planned Parenthood, most definitely go to PPAWI. Get educated, get involved. We have rapid response press releases that go out and updates about all the things within reproductive rights and social stuff here in Wisconsin. So that's what I would say to start when it comes to my lane. So look on our websites, get the alerts. We have Instagram, Facebook, TikTok. And just really keep abreast, and I always tell people move up that ladder of engagement. So not only just read and learn, but most definitely get involved.
I can bop in. This is absolutely correct, right? The way that the American healthcare system is arranged, which is a series of historical accidents and various like unpredicted incentives, means that there is no single like entry point. There's no standardized way to engage with it or find out information. And so people turn to, totally reasonably, the internet or friends and family. But that's also how you get things like Make America Healthy Again, or Aaron Rodgers' whole vaccine bullshit. People doing their own research. And so there isn't a very good answer, right? Like the best answer is community organizations upon whom the burden is now shunted to be a gateway point for healthcare access and answering questions, you know, knowledgeable, if luck of the draw, friends or family. No, we lack a standardized place to get these kinds of questions answered. And so we all are kind of to an extent on our own to bounce around Google and see what we can find. And so again, groups like Turner's have had that obligation kind of thrust upon them. And a lot of them do a really good job, but it's not adequate to the size of the need.
Where do you go to find out information?
Oh, I have a lot of resources. If it's health, well, I actually made a 3-page list of community resources if you'd like it, Emilio.
I would.
But yeah, I mean, if it's as far as accessing healthcare here in Wisconsin, I usually go, well, there's access.wisconsin.gov if someone needs to apply for Badger Care health insurance. You can also go into your local Health and Human Services agency to apply, or apply by phone. Here in Milwaukee, though, there's a 2-hour hold, so just know that. Or call right at 8 when they open.
And how would they find that number? What is that number? I mean, you don't have to give me the exact number, but how would I even Google?
Yeah, I mean, that's why I'm very organized with my resources. But in Milwaukee, it's Milwaukee Enrollment.
And so finding ways to curb the excesses of your Freiderts, of your Ascensions, of the groups that just build new hospitals for white wealthy people in Wauwatosa and pull hospitals out of rural areas or low-income neighborhoods. Regulation that targets them and redistributes that money into taking care of people, the places where they live, focusing on primary care, preventive care, rural care. That's where I think the real audacious policy frontier is going to be. So a couple of ideas in the hopper. We'll see where they go. Maybe they won't go anywhere. Hopefully they will go somewhere. But it's up to us at the state level to really go out there swinging.
You can go. Okay. Something that I want to talk about, it's adjacent to healthcare, so it's healthcare related, but not really the main thing. But this is regarding a law that was passed here in Wisconsin in 1991, so a little while ago now, and that's the Mother-Young Child Care Program. It's Wisconsin Statute 301.049. And that states that pregnant women and incarcerated women should be housed with their babies until the baby turns 1 year of age. And that has never happened in the entire state ever, even though it's a law, not a little program that could be available, a law that was passed in 1991. So like you mentioned, that the ACLU, they did sue the Wisconsin Department of Corrections in Dane County last year, and there was a ruling in Dane County Court in February of 2025 that they do need to start offering it forthwith. So that, in plain layman's terms, means right now. And that was in February, now we're in August, and it's still not being offered. They don't have lactation consultants. Women are even charged to use, breast pumps if they wanted to be able to express milk for their newborns or their children that should be with them, but still aren't. It's also been funded every year since 1991, so where's my tax money been going? But that, there's a healthcare aspect to it for the women, but also for the children. I mean, they're supposed to be creating that bond, and that's for that child's development as well. I can't imagine, and I doubt it's really even easy to calculate or do research on, like how many babies have been torn away from their mothers at 24 hours of age, right? That's devastating. And if a woman is incarcerated and they're going to an outside doctor appointment, they are still shackled, and they're still in their orange, jumpsuit in the waiting room at a regular doctor's office. That's extremely dehumanizing. And they only just stopped shackling women when they were in labor, just a few years ago. I heard a story earlier this year. This was in the jail, not in the prison, but it was in the jail downtown. There was a woman who was incarcerated. She was pregnant. They pepper sprayed her. She went into early labor. Her child was born with health problems and still has lung problems to this day. The little girl's like 2 or 3 years old, and they had to teach her how to laugh properly with her lung issues. And they had the woman who had just given birth sign some kind of waiver under duress saying that she won't sue them. So, I mean, and then, what about the ongoing health care or even access to, menstrual products or there's birth control available that could help somebody not get their menstruation cycle when they're incarcerated, and that would be a lot better because they're not having children, hopefully. That's a whole different story. But they're likely not getting pregnant while they're incarcerated, so why not have a birth control option available, a temporary one, as an option? But you don't get choices when you're incarcerated for health care.
Yeah, so for Planned Parenthood, what we have going on the state level that we're working with is that we have the Reproductive Freedom Act. And so, as you all know about that, and what's all in that is that taking that weird 1849 bill that we've all probably heard, taking that off the books. Most definitely, also in that bill, we want to recognize full bodily autonomy and make abortion a constitutional right. We have same physician, this part of that bill, where when women come and be seen for care when it comes to abortion care, that they don't have to see the same physician, which is like another barrier which is another barrier for women when they want to be able to get that access. And then also we have like we want to be able to ban right now there's a ban on telemedicine when it comes to abortion care. So we want to be able to strike that down so that it can be able to create access for rural people and folks that maybe can't take off and all the other things that are barriers for people. And as we know, virtual care is like the thing now, and so I think the thing is that we need to move the time and allow people to have like access to that. And then the other thing is the two visit minimum. And so here in the state of Wisconsin, when women want to be able to access care for abortion, they have to set up 2 visits. And so what that means is that if you live an hour or 2 hour away or somewhere rural, and you need to come to Milwaukee or Madison or Sheboygan, that's 2 days you have to take off work. There's 2 days that you have to find somebody to watch your kids. There's 2 days of gas, 2 days of hotel, 2 days of, all of that. And, most of the times that if you're in that predicament, you probably don't have the type of job that taking 2 days off is not a problem, And so those are the things that with the Reproductive Freedom Act that we believe that will most definitely move the needle when it comes to reproductive health care and reproductive rights here in the state of Wisconsin. And along with that, we really have centered health equity. And so what that means is that here in the state of Wisconsin, we're most definitely doing our due diligence supporting when it comes to combating infant mortality here in the city and the state of Wisconsin. So what we are doing, Planned Parenthood as allies, we are listening to the frontline workers, which are our Black doulas. And so we have paired ourselves with YDOT, and we are working with them as far as getting them to participate in the state budget, getting them and leveraging our relationships with our elected officials to make sure that these policies and these things are most definitely addressed as we try to do our part. And then I think the other thing is that that's really, really important is that we're working on sex education, so folks can have a really, really good comprehensive understanding of sex education, and just not get absent only or some kind of like weird video that you gotta watch in the PE or the HEF class. And so those are I could say the things that I am working on that most definitely I believe will make things a lot better for women and family across Wisconsin when it comes to accessing their reproductive health care.
Thank you, all three of you. And these sound clearly like nonpartisan issues. I mean, certainly nobody is happy with the state of what's happening in regards to health care anywhere. It's ubiquitous, no matter where you go. And I understand, too, these recent changes in many of the rural counties. You may have to go 2-3 counties over to access a hospital. Who is content with that? So this certainly seems like an issue where everybody needs to contact their elected official and reach out. We have a series of questions. Also want to remind you, those of you sitting here, feel free to ask a question, raise your hand, and you'll get an index card to write. I've already collected a few here. And you can pop in, you can answer the question, you can decline to answer the question. You can all answer the question. So with reproductive rights in their most precarious position within most of our lifetimes, and hostile legislatures on the issue at the state and federal level, what can we do to support mutual aid and groups and clinics fighting overwhelming odds here and in the United States? And just to back up, the governor and the attorney general announced their fight against that 1849 law in this room here.
Yeah. I think I kind of just go back to what I said earlier. You know, you get educated, get involved, donate, become a patient at Planned Parenthood, and let's hold these elected officials accountable for their vote.
I would bring up that the most vulnerable, and I'd say one of the most important parts of the entire reproductive framework is the abortion fund. You know, I worked with a lot of clients, patients who would come in and they had to bring their kids with them because they couldn't afford daycare. Or they, had to take off work, like Steven said, for a couple of days, and that was a huge impediment to their ability to pay rent or pay their bills. And what abortion funds do is they come in, and not only do they pay for care, but they pay for the accoutrement surrounding the provision of care, right? They pay for the hotel room. They pay for the child care. They pay for sometimes the airplane, ticket. We were flying folks in from Texas. And they are, after Dobbs, there was a rush of money to abortion funds, and that well is dried up. It's really, really hard to provide services. A lot of clinics are cutting back their subsidies for patient funding, and a lot of abortion funds no longer have the money to pass it the way they used to. So you can go to NNAF, National Network of Abortion Funds, not NAF, that's a different one, and find an abortion fund near you. The Wisconsin Abortion Fund and the Freedom Fund are two of the ones that work most in Wisconsin. And if you've got $20, throw your $20. I guarantee you, every single dollar is used as optimally as possible. These folks are eating gravel for lunch to pass on as much money as possible to the patients they take care of.
Excellent. We'll jump into the next question. How are immigrants and refugees impacted by all of this?
I mean, I'm hearing from people that are afraid to go get basic health care whatsoever. You've already got people who don't get health care because they're afraid of the cost, right? 25% of American families have medical debt. If you have medical debt, there's a 60% chance you don't seek further health care because you're afraid of cost. And of folks that don't seek health care, 40% say their health care conditions got worse as a result, right? Health care costs are the biggest barrier to people getting the care they need when they need it. And now if you got to worry about getting deported, about watching your child get black-bagged by the secret police, it's terrible. It's going to have a huge depressive effect on public health in these communities. It's atrocious. It is a secret police. And so we're going to see a lot of people turn to unlicensed medicine, or care at home, folk remedies. That's what happens when you have a community that doesn't have access to healthcare. They DIY it, and DIY healthcare, God bless, is not a sustainable, scalable, or humane option. No, this is. I wouldn't, obviously it's the part that I think about. It's not the, maybe the biggest part of it, but ICE, immigration, secret police, deportations will have a tremendous deleterious effect on the health care of those populations and the people who love them.
What can healthcare workers do to organize and fight back? So this is a question, and again, you don't have to know the answers to all of these, and if we don't, we can pivot and we'll, hopefully somebody that's watching can, and we'll share the information. But if you can speak specifically to healthcare workers, what can they do to organize and fight back?
Yeah, most definitely. Like I said, so I work at Planned Parenthood, and I'm like really like an organizer at heart. So what I would say is always power together, collective. I would say reach out to me here at Planned Parenthood, PPAWI. We can sit down, we can organize, we can figure out what is the best action to take with the power that they want to do. But I think the biggest thing is, reaching out and having conversation and coming up with a plan. But I think, there's a space for everybody at the table when it comes to these movements. I think the thing is that you just have to just show up at the table and find your space. But there is most definitely room for any nurse or anybody that just cares enough for them to reach out to Planned Parenthood and get involved.
Former union, former union, former union. Some of the most radical national healthcare policy comes from organizations like the National Nurses Union, which was at the forefront of the Medicare for All fight in 2019. Not everywhere can unionize. We saw what happened at the hospital at Meriter in Madison, which had their ability to unionize revoked from them. But a unionized workforce is one that's agile, that can fight back, that can mobilize against attacks to healthcare. But on top of that, there is this belief in a lot of healthcare spaces, especially among med schools and among doctors, that the practice of healthcare is a nonpartisan issue. That somehow the relationship we have to our own bodies and the provision of care is divorced from the political and economic conditions which shape that body and that care in the first place. We're seeing that trend begin to crack, but there is nobody more valuable in the fight for better healthcare conditions than a healthcare worker themselves. When you see a doctor or a nurse on the line wearing their white coat, wearing their scrubs, that not only does that have an important visual message, and branding's cool, those are the subject matter experts. Those are the folks people trust and listen to. And so if you can take 4 of your coworkers and go to a protest, you can take 8 of your coworkers and fill a legislative office, you can put out, a video or whatever with your peers explaining what's happening and explaining the paths forward. You as a healthcare worker have so much relative agency in a place where few of us have agency whatsoever. I think the organization, whether literal or like in a union or just general organizing of healthcare workers, is the only way we will ever get anything good to happen on healthcare movements in the U.S.
Excellent. As another question what are reputable online resources for people seeking medical advice and answers? That may be adjacent from what we're asking. I'm assuming this is in addition to Ask Jeeves.
I would say contact your doctor, consult your doctor, and make an appointment at Planned Parenthood. WebMD and all that kind of stuff, I wouldn't trust the internet. Just call your doctor.
And I should stop looking on Reddit?
Yeah, okay. Yeah, most definitely. That's what I would say. Just call your doctor, call Planned Parenthood. We promise you our door's open, and we will listen to you and get you the resources that you need.
The NHS, so the NHS, which is the UK healthcare system, has an emphasis on points of contact. They've got somebody you can call and talk to who will help you guide the system. Unfortunately, we can't use that. But they do have a lot of web resources that tell you basic information about what's going on and kinds of things to look out for and basic healthcare questions. A lot of their directions about, go to your GP and give them a quid or whatever, don't apply to us. But if you want vetted, scientific, government-backed information about healthcare conditions, the NHS.co.uk is a good place to get information that's reputable.
Thank you. And I personally like to look up on the NHS, kind of get a handle for what I'm going to ask, and then I ask my doctor.
Yeah.
And it took me, choosing a doctor is almost like dating. You see a doctor, you decide you don't like the doctor, it takes you need to speak to a yenta to figure out who knows a good doctor to maybe introduce you to a doctor that you feel comfortable with, and then you try out the relationship, and maybe you switch again. So that's also complicated under the best of circumstances. What can we do to organize impacted communities? So, and I want to avoid, carpetbagging and white saviorism, but what can we do to work with communities that are impacted to work with them?
I mean, go to where the organizing is already happening. There is going to be somebody or some group or some resource that has thought about all the things you want to think about, and go support them. Go see what they need. Whether it's literal showing up, whether it's some other kind of support, like self-organization. People know what's best for themselves in their own communities. And the most important thing we can do if we're not part of that community is to go find the people who are doing the work and offer our aid. We had when Dobbs was striking down, there were a lot of folks, and I know Stephen can talk about this too, who really wanted to help, but kind of took it upon themselves to do vigilante abortion support. It's a really bad idea. Like the anti-networks or whatever, right? Like, oh, I will take you into my house and I will help you get it. Like, that's really, really bad, because then you're creating infrastructure for strangers to talk to people who are committing a crime. Well-intended, very bad in execution. And people who are trying to organize these things often don't know what clients need, what a pregnant person needs to be taken care of and be safe. But there were plenty of organizations within abortion that were in reproductive health that were organizing and were doing things. And so a better use of time would have been to go to those organizations and support them, whether financially, whether through advocacy, whether through participating in actions. So find the folks who are doing the work and get in their corner.
Great, I got 4 other questions here. In addition to Planned Parenthood, what groups in Wisconsin are organizing regarding Medicaid cuts?
Caring Across Generations is a really big disability. Disability activists and disabled people have had thrust upon them the obligation of being the vanguard of healthcare organizing in a lot of the U.S. They're the reason the ACA wasn't cut in 2017, because it's literally life or death. Even more so than it is for any of us. Disability organizing is what gets the goods. One of the reasons the ACA wasn't cut in 2017 is because you had dozens and dozens and dozens of people in wheelchairs going to the Capitol and doing a sit-in, and you had videos of folks getting yanked out of their power chairs and thrown into a van. Barbaric, and also pretty bad optics. And that's one of the main activist orgs. ADAPT is the organization that led the fight against ACA cuts. And they're doing the same thing for Medicaid. One of the complaints I heard a lot during Medicaid organizing is that the activists were all there. They were fighting. Disability was fighting. There's a lot of groups in Wisconsin doing that too. Politicians weren't the ones showing up. In 2017, you had door-to-door, round-the-clock, somebody trumpeting about ACA cuts, and that was good. That was good noise. And we didn't have that level of coordination or support from National Democrats. Hakeem Jeffries was not making as much noise as perhaps he could have about Medicaid cuts, and I think we saw the consequences of that. So if you want to pick one group to go look for Caring Across Generations or any other disability group in Wisconsin. We've also got the Board for People with Developmental Disabilities, BPDD, who was one of the core organizing parties against Medicaid cuts. A lot of people are sitting and licking their wounds right now, trying to figure out what to do next. We're in unprecedented territory. Nobody knows what's going to happen. The state hasn't even announced how it's going to handle the cuts. So there's a lot of anticipation, but those are the folks who will be closest to the line and will be the ones fighting the hardest.
Thank you. I've got 2 specific questions. Stephen, given government backlash against abortion health care, how committed is Planned Parenthood to continuing services?
Yeah, so first of all, our mission, our motto is we care no matter what, our doors are open. And so right now, we are in the midst of litigation with this big, beautiful bill. And so during this injunction, we are most definitely continuing to provide birth control, STIs, wellness, and wellness cares. We're committed to fight, like always, and this is ongoing. And so we're trying to stay flexible. The Trump administration still could appeal. But right now, like I said, we're in litigation, our doors are open, and we're still providing the care for Wisconsinites that they deserve.
Thank you. Crystal, how does access to health care, including care related to substance use disorders, improve outcomes for people returning from incarceration?
Well, I think it's essential. Whether we're talking about substance use disorder treatments and support services or mental health services, having been incarcerated, that puts a big impact on somebody. So whether someone may have already had a mental health disorder or concern prior to incarceration, maybe related to whatever those circumstances were that led to their incarceration, or just the fact of being incarcerated. There's a lot of isolation, there's a lot of uncertainty, there's a break from your family and friends and community, and then you're suddenly back out and, other people that they may not understand what you're going through, right? And you might need that, you need health care, even if it's mental health care or substance use disorder treatment. If somebody doesn't have that, it's very easy, or if they feel alone or something, it's very easy to go back into unhealthy habits that can be quite harmful. Or just the fact, if we again are talking about a substance use, if people are regularly using either drugs or alcohol, their tolerance is often usually high, right? Then they get locked up. Hopefully they did not have access to any of that while they were incarcerated. Now they come out, they're feeling depressed or alone, and they reach back out for that drink or that drug, and they think that they can use as much as they used to. But they can't, because they don't have as high of tolerance anymore, and that really, they are at a very high risk of overdosing within the first year. So I think it's essential for people to be stable. Healthcare is critical need for people that are releasing from incarceration. Otherwise, who else can you talk to, right? The Wisconsin Department of Corrections is pretty good at keeping stats on people, and they'll break down people that have, mental health diagnosis, and it's staggering. I think, I don't want to give wrong numbers. I didn't bring the brochures with me, but they update their stats every year. You can look at it, across either by institution or just people on community corrections, people actually incarcerated, or youth. And you can see that it's a very high rate, even just for mental health treatment that might be needed. If somebody doesn't have support, it's likely they're going to end up getting back into some kind of behavior that leads to them being incarcerated again. And that could either be just breaking a rule, right, and getting locked up, or committing some other crime. And often with crime, there's a victim. Not in every case, but there often is. So healthcare is also a safety issue. It's a community safety issue. We really need to make sure that people are supported more. And not everybody is released with information on how to even apply for healthcare. Yeah, there are social workers, but they are very understaffed and overwhelmed. They can't get to everybody, or someone might be releasing and they're not on any kind of supervision, so they really don't get support. Or for our old timers, and what I mean by that is people that are sentenced like 20 years to life and now they finally made parole, they don't have much support. If they make parole, you're out in a month. You never got any reentry programs through DOC, because they go off of your release date and they start within about 6 months before your release. If you're 20 to life, finally around year 30, you make parole, you're out in a month. And I don't know if a social worker is able to interject real quick and sign you up for Badger Care, And it's, or even just how do you apply online for these things? You don't know how to use technology because you've been out of the community for so long. It's multi-layers, multifaceted issue, but healthcare impacts everybody. And like I said, if we're talking about justice impacted people, it can lead to reincarceration. It can lead to their death, right? I carry Narcan even before I worked in reentry. I worked at the job center. I carry Narcan everywhere I go. I have it at home. I have it in the diaper bag. I have one in my backpack. I have one in my medicine cabinet, just in case, but I'm only one person. So make sure you talk to other people too and let them know what's available, right? And community, healthcare plans that are out there for individuals.
Excellent comprehensive answer. I would only add also that people who do not have the luxury of having health care, physical and mental health care, may also self-medicate because they don't know what they need, and then they'll take alcohol or narcotics or whatever it is to cope with the issue that was never diagnosed. So 3 last questions before we jump into closing remarks. What health access may be available for freelancers and small business owners who are not a part of the institutional workforce to unite?
Say that again? I'm sorry.
So what health access may be available for freelancers, gig workers, and small business owners who aren't part of the institutional workforce?
Yeah. So what I would say for Planned Parenthood is that, one, Planned Parenthood is for men and women, and so we have a whole host of things. We don't do just abortions, and so you can get a vasectomy, you can get wellness checks, STI. We even have like a QUIC, which is quarterly contraceptive kits, where your birth control and all of that is mailed to you, and so you don't have to take off work again, you're just on your doorstep. Yeah. I forgot what I was going to say.
That's okay. That was good.
So as a class, there's not a particular healthcare resource for freelancers or gig workers, or whatever, right? You know, you've got like the ACA marketplace for buying insurance if you're self-employed or a gig worker at insanely unaffordable costs. They're going to get worse next year. You can look up federally qualified health centers in your neighborhood. That's usually the place to go if you have any kind of healthcare need or you need to be addressed by somebody. Like their FQHCs, as they're called, are like the backbone of public health in the U.S. And as you can probably anticipate, they're super understaffed and overworked. But that's where the real work of public health and taking care of people happens. And you should take advantage of them if you can. I used to, in the Haight-Ashbury, where I used to live in California. So yeah, I mean, if you are generally a person who is not protected by the system, who is not served, who falls through the net, find an FQHC in your neighborhood and see what they can do.
Yeah. It came back to me now. All right. So those are all their services, but when you come to Planned Parenthood, we do have navigators so that you can come in, they can help you navigate and figure out what exactly it is, what you need in order to be able to get on badger care and whatnot. And we also have other flexible ways that we meet people that don't have insurance as well to make sure that they have their care. And then also, if there's something that is discovered, detected, is outside of the scope of Planned Parenthood, well, we have a lot of really great partners that we partner with, so that we can, refer you to them to get your care. But yeah, freelancers, inspirational people, period. Yeah, come to Planned Parenthood. We can most definitely get you the things that you need.
Thank you.
I have one thing I want to add quickly. I pulled up that 3-page list and I just emailed it to you.
Thank
so you
you.
Can publish it
We'll
later.
share that with you.
So the state of Wisconsin Department of Health Service has a really good resource to find free or low-cost health clinics as well. So
Could you repeat who has that service?
Department of Health Service, DHS. They're the ones that do badger care and food share and stuff. They have a list, though, that includes medical and dental, free or low-cost health clinics throughout the state. It's DHS, so www.dhs.wisconsin, spelled out, .gov/, then the word forward, health, /clinics with an S. But Emilio has it now, too. I'm sure he'll add it later.
Yes.
But there's a whole list. They have a lot of resources.
Thank you. And final 2 questions. Can any of you talk about Ascension Hospital's outsourcing physicians and how that will affect Medicaid recipients and also other clinics that serve people on Medicaid? Will it affect their ability to receive care at Ascension? Numbers, wait lists at the various clinics? I don't think people are aware how serious this impact will be.
I don't mean to be glib, but we have no idea how bad it's going to be. All we know is that it's going to be bad. I have not found a single time that a private equity firm entering the hospital provision of care space has ended up with better care for patients at a lower cost. For those of you who don't know, Ascension decided to outsource big part, I don't remember exactly which departments, but large parts of their emergency care services to a private equity firm, like a staffing firm. This gets them around any kinds of loophole. It's basically a loophole preventing them from falling afoul of any kind of like private equity regulation that might exist. They just pass them in Oregon. It'd be cool to pass them here by just kind of like breaking it off, like, you know, by atomizing the hospital and spinning off whatever you can into a private service. What a private equity firm is, it's a company that buys up another company and makes its money by making that company selling it at a higher cost. And the way you do that is you either increase revenue or you decrease costs. And a great way to decrease costs is fire a lot of workers and cut corners whenever possible. That's like the tension of private equity, is that it's really hard to make more money by doing good work and improving your quality of care, and it takes a long time, but it's really easy to make a lot of money by just slashing what you have to the bone and then pawning it off on the next sucker. And that's been the history of private equity in healthcare for the past 30 years. And this is a new permutation as far as I'm aware, and I'm not optimistic about what's going to happen. My hope is that workers at Ascension can put their foot down, and I mean, I think that's our front line here, is internal revolt over this practice. But it's going to be bad. You know, we're going to learn about the horror in real time.
Yeah, same here. It's just it's bad. I think it's going to be a ripple effect, and we'll see. But as far as like Planned Parenthood, when things like this happen, it really puts a strain on the healthcare system at large, and so we start seeing a lot of people come to our doors and whatnot because they're not able to like access. And so this is, you know, all these things. This is why it's important for people to really, really show up for Planned Parenthood and show up for like Medicaid, because you know, this issue is just not like an island on its own. It has, you know, loads of intersections that you know, we won't really know about until it's too late. Yeah, I mean, when it's too late, that means that undiagnosed cancers, unattended pregnancies, STIs that aren't treated, and people die.
Final question of the evening. Can you forecast what birth control, gender-affirming care, and HRT, also known as hormone replacement therapy access, might look like in the coming years, or is that also an unknown at this moment?
It's always under attack. It is a little bit unknown, but what you can expect is that, you know, at Planned Parenthood, we are committed to that community. We are committed to continue to protect and expand, you know, access for that. And so right now, just one of those things just kind of like circles back around to like how important like these issues are, because it affects everybody, and it affects everybody like differently. But we are most definitely in a space that this is important to us and that we need to hold the line.
Great stuff. We've learned a lot this evening. I think there are repeated threads of our need to organize, our need to educate folks, our need, as expressed through the questions and what we're hearing, the confusion that is all over across the city, across the state, and our need to find answers as we try to reach out and make some sense of this. Such an incredibly complicated topic to discuss. You know, even with all of this information, it seems like we're only scratching the surface. A lot of these questions seem like they could be their own program. And it's the surface of a system that was broken before any of us were even born. But to quote one of our favorite abolitionists, Miriam Kaba, let this radicalize you rather than lead you to despair. The only way out of this is through educating ourselves, through advocacy, through community care. And it's clear that we each have a role to play. And whether you're on the forefront or you're showing up to offer solidarity and a listening ear to other folks, if you are offering to escort folks, if you're offering to stand as an observer, a legal observer, an escorter, protection, or as care to drive an elderly person somewhere, or to help somebody access the internet and look these things up because they have no idea and they don't even know where to go to begin to ask. I want to thank each of our expert panelists here, Stephen, Crystal, Timothy, and our tremendous audience online and in person. Before we go, we'd also like to thank our sponsors, the Public Welfare Foundation, Wisconsin Voices, the Kohler Foundation, the Hertzfeld Foundation, and Porchlight Books, our wonderful staff, including co-producer Jahan Batuman and the many volunteers who made today possible. And a huge thank you to our video producer and film crew, Loki, who is also newly placed with us as he completes his master's in social work. Right over there, that guy, right there. And of course, Jaleese and Michaela. I'd like to thank DJC Interpreting Services. Derek Kanian, who heads DJC, also has an exciting ribbon cutting for his green stormwater infrastructure. You can tell I'm from Brooklyn, right? Stormwater. Infrastructure project and the unveiling of their art intersection, MKE's new outdoor art gallery, an inspiring fusion of sustainability, creativity, and community pride. This Friday, September 26th, on Friday, September 26th, 11 a.m. to 12:30 p.m. at 3542 West Vliet Street, Milwaukee. He did not ask me to say that. I stole that from an email. If you enjoyed this, we have a couple of great free events you should attend over the next few weeks. It is more important than ever to gather together, to work, play, and learn together. This can be depressing if we don't find time to celebrate with one another as we fight for our beloved community. I'm going to give you a few brief things that are coming up. There's always more you can find on our website. August 21st, Know Your Rights training at Clark Square Park from 5 to 6 p.m. with Juanito Arevalo. August 25th, Know Your Rights at Your Move Milwaukee from 5 to 7 p.m. August 22nd is Loteria Night with our friends at Comité Sin Fronteras from 5:30 to 8 at the Mitchell Park Domes. Go there, buy me a ticket. I don't gamble, but I will reap the prizes. September 19th, we're going to be discussing healthy cities with Dr. Eric Kleinenberg, who wrote in 2018 Palaces for the People. It's fascinating. That's at Milwaukee Public Library, and I'll be your moderator for that. September 20th, join our wonderful team of Milwaukee Turners Legal Observers by taking our next free Legal Observer training right here on Saturday the 20th. And then on September 21st from 5 to 7 p.m., Immigrants in Crisis, Our Stories. That will be with Forward Latino, Bay Bridge, Milwaukee County, Micah at the United Methodist Church of Whitefish Bay. And then finally, if you want to see this really awesome, majestic building, and you're not a panelist who comes early to see the powdered people we have on the shelves in our funerary urns, doors open, Milwaukee, one of my favorite two-day events, September 27th, 28th. We are open for both of those events at 10 to 5. If you're interested in becoming a docent here with us and giving your own tours, you can email volunteer@milwaukeeturners.org. Our next wonderful Vel Phillips Forum is on the book Propaganda with the author, Alek Karakatsanis, on October 8th, so be here for that. And also, if you want something more low impact, come join us for free Tai Chi, free Zumba, free yoga. We offer that at 6 or 7 sites almost every day of the week. Check out our website for more. And also please join Connie here, who heads our program. Join us for our substance abuse recovery support circles every Tuesday at 5:30. That's a whole lot to do. We'll share it online. You don't have to remember anything I said. You have to remember what they said. Until next time, please take care of one another. Good night.